today. Super short and sweet lecture this week about the scope of practice for respiratory therapists. I'm graduating in a little over 2 months. I'm so excited, but even this, this sounds silly, but this was still a good review for me. Like it's nice to go back to the basics when you're knee deep in the specifics of things and just to take a step back and look at things from a bigger picture. So it was fun to go back and look at these different elements of care and scope of practice that a respiratory therapist has. So we'll go ahead and get started. Scope of practice for respiratory therapy. What exactly do we do? This is a super nice, short and sweet video that you can go to, and it shows you a little bit about the typical roles of a respiratory therapist and what a day in the life of a respiratory therapist is like. It's cute. It's fun. So if you have some time, go check it out. It's a good little video. What is a respiratory therapist? They are a specialist in educating patients about diagnosing, managing, and treating cardiopulmonary disease, with an extra emphasis on cardiopulmonary. So, this right here is where we spend all our time. Cardiopulmonary disease. This is our specialty. This is what we're dependent on to know. And it's exciting because the cardiopulmonary system, if it's malfunctioning, everything else is also malfunctioning. So it truly is one of the more important parts of the human body, and making it properly work is a pretty important job. So there you have it. One of the most important responsibilities of a respiratory therapist is their patient's ventilation and oxygenation. It says let's look at some of other things that respiratory therapists are responsible for. As a student, I don't know, maybe you guys are a heck of a lot smarter than me, than I was when I started this program, but ventilation and oxygenation are two separate things, and I didn't truly understand that, I think, until I was like middle of the first semester of respiratory school. So ventilation, just in definition form, is strictly the movement of air, the movement of molecules from atmospheric air to alveoli. That's what ventilation is. Oxygenation is the taking of those oxygen particles and moving them over the alveoli membrane to the blood supply. So two separate things, super important, but we start to use, you stop using terms like air so much because you have to specify what you're doing with the air, where the air is coming from. Like, I remember using just the word air all the time, and knowing the different parts of air and what we're talking about, ventilation, oxygenation, perfusion, is what I feel like would have been helpful for me. So I'm telling it to you. So, roles of a respiratory therapist. What do they do? Responsible for blood gases. We have this acid-base balance that the body is consistently working to stay within. The body has an incredible compensatory mechanism that allows it to be able to stay within this pH range of 7.35, 7.45. It's constantly compensating to try to keep it in that sweet spot. And a role of a respiratory therapist is not only to draw the blood, the arterial blood that is used for this analysis, but then to be able to interpret the analysis and to be able to know what interventions and what needs to be changed in order to make sure that that patient is in a healthy place as far as their acid-base balance is concerned. So you have this sweet spot of 7.35, 7.45 pH that you want to stay within. So you have to know what types of therapies, what kind of mechanical ventilation, what types of medications, all kinds of things to be able to keep your patient in that safe and healthy range. Funny story, this is going to be a really entertaining lecture. I was super excited to do blood gases, so we do blood gases on each other in the program, and I thought I was super smart because I volunteered to be the person who would have the blood gas drawn on them by the older like the more advanced students and the teachers. So I was basically the example student, and then everybody would go from the example to go do it on each other. Anyways, so I thought I was super clever and super smart, and I'm like, listen, I'm gonna have the experienced guy do it. He's gonna draw it on me. He's gonna get it. I'm not gonna have to worry about these newbies, jabbing all over in my wrist to try to find my artery. I'm totally gonna just volunteer and get it done and over with. Joke was on me because I get up there in the very front of the entire class, all of our teachers, everybody is there that day because it's a pretty crucial day and it's a little dangerous, so they want to make sure they have enough help available. So I get up there. He's fishing in my arm. He didn't get the artery on the first stick, and I'm like, okay, I can do this. And all of a sudden, I start sweating. I start going totally flush, and I passed out in front of the entire class on the floor, and then barfed also in front of the entire class, and I just had to lay back in the lab on the hospital beds that are meant for the mannequins, and literally had to be cared for because I was super zealous and thinking I was hot stuff and one step ahead of the game by volunteering, and I was extremely humbled because I made a fool of myself. So there's a funny story about blood gases and learning to draw blood gases, but super crucial role in respiratory therapists' daily scope of practice is drawing and analyzing blood gases. Polysomnography, a super fancy word for a sleep study. To be honest, I don't feel very confident in interpreting sleep studies. I feel like there are specific sleep study techs that are trained to read these graphs from a polysomnography reading, but I did get to go in and observe the sleep lab one night and just kind of watch how it's set up and how many probes are placed on these sweet patients and how they somehow have to try to sleep at the hospital and every move is being watched. It's quite the process. So it's very interesting to watch and super helpful for these people who are suffering with their sleep. So yeah, that's another outlet, another area that respiratory therapists focus on is sleep studies. Intubation. This is a crucial role for respiratory therapists. However, it differs in scope of practice depending on the facility that you work at. So a lot of Intermountain facilities, their physicians and their PAs and nurse practitioners do the intubations. University of Utah, for example, they have a lot of medical students there, so they typically get to do the intubations because they need the experience. In like a same-day surgery center, like across the street from McCady Hospital up here in Ogden, the anesthesiologist does all the intubations. Usually in surgery, the anesthesiologist performs intubations unless the patient has been emergently intubated in a different location. But typically, if somebody's coming in for an elective surgery, they will be intubated by an anesthesiologist. In the ER, most often I've seen doctors doing intubations. However, there are some NICUs that allow their respiratory therapists to try a couple times on intubations, and some therapists that are really, really good at it. And then some smaller hospitals too can perform intubations as well. So super neat. It's an incredibly crucial role a crucial skill to be able to have and be able to secure that airway and maintain it and provide, whether you're bagging a patient or connecting them to mechanical ventilation, the first step is intubation, and it's pretty incredible to watch. So hooray for that. Moving on to mechanical ventilation, this is where things get super exciting. There are all kinds of different ventilators, all kinds of different mechanical ventilation strategies to use, different kinds of modes to ventilate a patient. This is where you really start to get to the nitty-gritty of the respiratory knowledge and knowing about that cardiopulmonary system, because you are the one who's in charge of making these changes and monitoring the patient and knowing when pathophysiologies are changing or occurring or getting worse or getting better. You're the one who's doing those regular vent checks and assessing your patient. So mechanical ventilation is absolutely crucial. as a role of a respiratory therapist and their scope of practice in today's hospital world. This is a hilarious shirt. I actually want it because we have all of these equations memorized right now to be able to pass our boards, and it's just a nice reference point, and I think it's funny. So air goes in and air comes out. How hard can it really be? Well, here you go. All kinds of fun equations to memorize to be able to analyze and assess your patients. Pretty interesting. Incentive spirometry, anybody I'm sure who's ever had some sort of hospital stay. I remember even when I had my babies, a respiratory therapist would come in and bring an incentive spirometer. It just helps you take deeper breaths, helps you to be able to open up those alveoli so that you're not having any type of, it's called atelectasis, where your little alveoli are collapsing, and that can cause all kinds of pneumonia or problems during your hospital stay. So you're the one in charge of encouraging this incentive spirometry to shorten patients' hospital stays and to help them after surgery to make sure that they're taking deep enough breaths so that they don't get sick from just sitting still in bed all day long. So that's your role, to encourage incentive spirometry and to use it as a form of therapy while you're treating your patients. MDIs and DPIs. MDI stands for a meter dose inhaler, which is this one here if you're looking at the screen on the left. And then a dry powder inhaler, a DPI, is the one here on the right, the purple one. One is an aerosolized medication, and the other one is, like it says, a dry powder inhaler. And your role is to make sure that these medications are administered properly. I can't tell you how many times I grew up with asthma, and my little kids have it, and even still I got into respiratory school and realized for years and years and years I had been taking my inhaler wrong. I wasn't taking my medication properly. I wasn't, there's certain things that your doctor tells you when they give you the medication, and you just kind of let it go in one ear and out the other, and you don't realize, oh wow, this could really have consequences. I should probably listen to that advice from the doctor. So, yeah, pretty interesting stuff. There's a lot more that goes into it than I ever thought there was. In my simplified mind before respiratory school, you just breathe it in and you're good to go. So, it's your job as a respiratory therapist to know the ins and outs of these medications that you're administering to your patient and to know how to properly deliver them. Aerosolized medications, also known as SVNs or small volume nebulizers. It's another mode of delivery for medications where you take a solution and you put it into this little cup, and it is broken up into teeny tiny particles, and the patient breathes it in as a vapor here on the mouthpiece. So also your job and role to be able to understand the indications and contraindications and the ins and outs of the aerosolized medications that you're providing for your patient. So super important stuff. These are the different types of masks that we use to deliver those aerosolized medications if we're not using a mouthpiece like this here. This is our mouthpiece. And then if you're not using a mouthpiece, these are the typical masks that we place on that allow you to not have to hold it there in your face the whole time you're taking your medication. Then we have CPAP and BiPAP, both forms of sleep support typically. BiPAP is also an emergency mode of ventilation for patients who are in respiratory distress. So CPAP stands for continuous positive airway pressure, which helps mostly with patients who have obstructive sleep apnea. It provides just a constant pressure in their airways to keep blockages out of that airway so that they can maintain and breathe at a proper rate and depth and volume. And then BiPAP, I can't even remember what bi stands for right now. Bi-level. It means bi-level. Oh, wow. What a great student aid, right? No. But BiPAP is essentially, the difference between BiPAP and CPAP is that CPAP is a continuous pressure. It does not change. So it doesn't increase or decrease with inhalation and exhalation, where BiPAP does. It increases and decreases to help facilitate that movement of air and ventilation to kind of ease the work of breathing for that patient who's in respiratory distress, or if they're not breathing at night, for example, like we have obstructive sleep apnea, which typically those patients will require a CPAP, but then there's also central sleep apnea that isn't a result of an obstruction in the airway. It's actually a neurological problem where your brain doesn't send the cue to your diaphragm to contract and draw in that air. So those patients need a little bit of help to breathe at night because their body forgets. So a BiPAP would be used in that situation as well. Respiratory therapists read x-rays. You read x-rays all the time. And it's super interesting because I feel like good respiratory therapists read x-rays. They're usually taken from an x-ray tech or somebody that comes up from the, I can't think, the imaging department. And then they take the x-ray, and then the x-ray is placed in the patient's chart. Usually you'll look at the x-ray if you've intubated a patient and you want to make sure that your endotracheal tube is in the right location. You verify it's in the right location, and then sometimes like therapists don't even look at their x-rays again. But it's a great trending tool to make sure that your patient is either getting better or getting worse. It's a great diagnostic tool to figure out what the pathophysiology is or what the struggle for that patient is. Incredible tool. Very different. One person can read an x-ray and then another person can read that same x-ray and get a completely different diagnosis from it, or a different conclusion from it, I should say. And so you kind of have to take it with a grain of salt and use your best skills and make sure that you know what you're looking for. Essentially, that's what I'm trying to say, because things can be easily missed or misdiagnosed. But super interesting to be able to read x-rays every day. Another role of a respiratory therapist. Patient assessment. I remember when I started school that one of our instructors told us that patient assessment is single-handedly the most important skill that you will learn as a respiratory therapist. And now going through clinical and being with patients, I believe that. You have to be able to know what baseline is, and you have to be able to recognize when that patient is differing from baseline. You have to know how a body functions and then know what to look for when it's malfunctioning. So if you can be cued into those things, those subtle changes that are telling you and giving you little clues about what is taking place in the body, while you're in there doing your vent checks, or you're in there assessing a patient or giving a breathing treatment, you're another set of eyes and ears for the interdisciplinary care team for that patient, and it's your job to make sure that you are giving the best care possible. And patient assessment is a huge priority for that best practice care. Respiratory therapists also attend quite a bit of home care appointments. They go into the home. We are approaching this age where the baby boomers are all retiring and becoming, what do I want to say, elderly maybe, and are requiring a lot of oxygen therapy, a lot of pulmonary rehabilitation. There's a lot that's going to go into caring for this older generation, and they need a lot of help in their home specifically. They may not be sick enough to be admitted to a hospital, but they may need, They may need care at home. That's what I'm trying to say. Assessing at home. They may need observation at home. They may have questions. Their oxygen may not be working properly. There's so much that can go on at home when you don't have somebody watching you 24/7. So being able to make home appointments and check in on those patients, make sure their equipment's functioning properly, make sure that they're feeling okay. Super important part of respiratory therapist jobs. Emergency resuscitation, I feel like that's pretty self-explanatory. You are the airway in that situation. When you have a patient who's not breathing, who's possibly having a cardiac arrest, or who has sustained a trauma, your role specifically is to focus on that airway, to either stabilize the airway, to help with intubation, or to provide bag valve mask ventilation until you can have them placed on a mechanical ventilator, or until they begin spontaneously breathing again on their own. So I'm sick, but this is my favorite. One of my favorite parts of being a respiratory therapist is having that ability to be cool, calm, and collected in these crazy, chaotic situations where you're literally walking the line between life and death, and to be able to stand in there and be somewhat useful and helpful to that patient in such a dire moment is a pretty incredible opportunity and a role that respiratory therapists get to play. Pulmonary rehabilitation, this is for a lot of patients who are suffering from COPD, chronic obstructive pulmonary diseases. They want to be able to have a good quality of life, but they have these pathophysiologies that are happening within their lungs that are causing their normal activities of daily living to be harder, and they can't breathe walking up the stairs anymore like they used to, or they used to go on walks every day and they can't do it anymore. These pulmonary rehabilitation programs take these patients in and they do a ton of baseline testing and then work with them to be able to give their body the ability to work and gain some of that strength back. They don't typically go back to life before their pulmonary rehab, go back to a normal life, but you can help these patients significantly be able to breathe better than they were before. So super cool. There's so much versatility in the respiratory world. You can work in a hospital, you can be in asthma education, you can work in schools, you can work in clinics, you can work in sleep labs, you can work with home care, you can work with what were we just looking at? Pulmonary rehab. There's so much versatility, and it's great because you're never in the same place. Even in the hospital, you have patients who are out on the regular floor. You make rounds to NICU, you'll make rounds down to the ER, you'll have patients that are in the ICUs, and you're never in one place. And I honestly think that's so much a part of the reason why I was drawn to respiratory care, is that you're always doing something different, and I think it's fantastic. Pulmonary function testing, to be able to check the functionality of your lungs, I feel like is the best way to simplify that test. Are you breathing in enough volume of air based on the measurements of your body? Are you able to get that air out? Are you able to do it multiple times? Like there's a lot that goes in with pulmonary function testing, but this is typically an assessment tool to figure out where a patient's baseline is, to diagnose a patient with COPD or with some type of restrictive disorder. It's typically used as a diagnostic tool, but can also be used as a trending tool as well to figure out how a patient is progressing, say with pulmonary rehab or with asthma medication and whatnot. So pretty cool to be able to do that with, figure out how much the lungs are working at full capacity or not. So pretty sweet stuff. Smoking cessation. Education is a huge part of being a respiratory therapist, and I would also add vaping cessation into this PowerPoint as well. Vaping, I feel like, is almost becoming more of an epidemic than smoking is at our day and age. So education. There's a lot of opportunity for respiratory therapists in education as well. We have roles, people who are called pulmonary educators. I'm pretty sure that's the official title, or that's specifically their job. They are around a patient when they're admitted to a hospital or they're having an exacerbation, and they help them go through their admittance in the hospital, and as they are discharged home, these pulmonary rehab specialists call those patients and help them possibly get into a pulmonary rehab, or help with finding resources to stop smoking, or help with support groups, or they're just basically your helping hand to be able to stop smoking and to provide your lungs the opportunity to breathe better and not be breathing in such terrible things all the time, especially with vaping. So pretty cool. High risk deliveries. I said that CPR and resuscitation is one of my favorites, but these high risk babies and deliveries are for sure my favorite. So this is the most special thing I've ever seen, to be able to watch these teeny tiny babies be born and struggle to breathe on their own. They're trying, they're working, that drive is there, but be able to have them intubated and to see them comfortably kind of get into their routine and be okay is so incredible. So that's one of my very favorite parts of respiratory care, is to be with the babies in the NICU and to go to high-risk deliveries. Bronchial hygiene, it's important to keep those lungs clean. We want to be suctioning out any gross mucus or mucus plugs, even trachs over here, constantly need to be suctioned. So those specifically are prone to having plugs and quite a bit of mucus produced. So making sure that those airways are clean and clear is absolutely crucial to making sure that your patient can oxygenate properly. Performing and interpreting electrocardiograms here, so being able to look at a patient's ECG and determine what is taking place with their heart. I won't go into all the details of that, but it's a very critical area of analysis to make sure that your patient is not having a cardiac event or a heart attack, a myocardial infarction, for example. Being able to interpret ECGs is one of the first things that a patient would have done, or a doctor would look at to see if that patient is indeed having a cardiac event. So those are critical in being able to provide quality care for a patient in that emergent situation. And then finally, we have these two last videos here. One of them is about just a man and why he chose respiratory care, and kind of a day in the life of a respiratory therapist. I'm trying to remember what this other one was for. I watched it. Intubation, I think. Don't hold me to it. But go through it, check it out. There's some super interesting stuff. I know this information can be kind of dry, but I tried to keep it as exciting as possible. Bottom line here, hold on, I'm going to sneeze. Bottom line here is that the field of respiratory care is so versatile and so rewarding. You get to use your brain. You're never doing the same thing on the same patient, on the same disease process. It's always different, and you get that satisfaction of being able to work with people and see them heal, or help them peacefully die, or help these babies coming into the world who are struggling. It's a very rewarding career, and I hope that if those of you who are considering it if you spend some time looking into these scope of practice areas, I know that you'll be able to find something that would interest you, that you would find rewarding in your life as well. So, hooray for respiratory therapy. There's my spiel. I love it. I'm passionate about it. I hope you can tell. But I hope everybody has a great week, and that everybody is staying safe from COVID. I'm getting excited that we're kind of moving through the summer semester, and if anybody has any questions or has any corrections or just wants to reach out, please feel free to send me an email or respond in our discussion boards. But other than that, take care, and we'll talk to you next week.